Hello students, in today's video we are going to study pharmacology of anti-influenza virus drugs. Now influenza, also known as flu, is a common viral infection. It causes an acute respiratory infection that attacks lungs, nose and the throat. Now signs and symptoms in mild disease are cough, fever, sore throat, muscle pain, headache, runny nose. Now these symptoms persist for 7 to 10 days and then the disease cures on its own. Only drugs to provide relief from the symptoms is required by the patient. Now severe cases may progress to shortening of breath. Now this acute respiratory infection can be deadly, especially in high risk group. So anti-influenza virus drugs are used in the prophylaxis and in the treatment of severe cases of influenza and also in high risk patients. Now, in order to understand pharmacology of anti-influenza virus drugs, it is very essential to study the structure of influenza virus. Now, influenza virus is an RNA virus. Now, outer envelope is made up of lipid bilayer. Now, below the lipid bilayer is a layer of matrix protein. Now, the outer envelope consists of special proteins, special glycoproteins, namely heme agglutinin, then neuraminidase, then M2 proton ion channels. Now, inside the virus particle is present a ribonucleoprotein, in short RNP complex. Now, this complex consists of viral RNA segments and nuclear proteins. Now, each viral RNA segment is bound by a RNA-dependent RNA polymerase. Now, this RNA-dependent RNA polymerase is required and it is very essential for viral replication. That means for the multiplication of RNA virus. Now, this enzyme is also essential for transcription, that is for the synthesis of viral messenger RNA. Viral messenger RNA further induces translation and viral proteins are synthesized. Now, for producing infection, the heme agglutinin proteins, they bind to the sialic acid residues which are found on the host respiratory epithelial cells. Then neuraminidase, it is an enzyme, it is a sialidase enzyme. It cuts the linkages between sialic acid on the host surface and heme glutenin of the viral progenies, so that viral progenies are released from the infected host cell and they can infect other host cells. Now these M2 ion channels, they possess hydrogen ion or we can say proton channel activity. Now these M2 ion channel, they open and they mediate transportation of protons inside the virus particle. Now this acidifies inside core of the virus, facilitating viral uncoating and the release of virus ribonucleoproteins inside the host cytoplasm. So, this is the structure of the influenza virus. Now, let's classify anti-influenza virus drugs. Now, first category is of M2 ion channel blockers. The drugs are amantadine and rimantadine. Then, neuraminidase inhibitors. The drugs are oseltamivir, then zanamivir, then laninamivir and piramivir. Then viral RNA polymerase endonuclease inhibitors. The drugs are baloxavir, then favipiravir. So this is the classification of anti-influenza virus drugs. Now let's study life cycle of influenza virus. Now this life cycle of influenza virus helps us to understand targets and mechanism of action of anti-influenza virus drugs. Now this is the host respiratory epithelial cells and this is the influenza virus. Now heme agglutinin of influenza virus fuses with the sialic acid residues on the host cell. And then the virus enters the host cell by the process of endocytosis. Now M2 proton ion channels open and they mediate pumping of protons inside the viral structure. Now, this acidification inside the viral structure causes uncoating and release of ribonucleoprotein complex in the host cytoplasm. Now, this viral ribonucleoprotein complex is then transported in the nucleus of the host cell. Now, this is one viral RNA segment with RNA-dependent RNA polymerase enzyme, in short RDRP. Now, very important to understand here that this RNA-dependent RNA polymerase enzyme performs two main essential activities. Now, first activity is the replication of this viral RNA. So, multiple copies in hundreds and thousands copies of this RNA virus are produced by the RNA-dependent RNA polymerase. Secondly, this viral RNA is transcribed to produce viral messenger RNA. Now, this viral messenger RNA that then uses the host ribosome to produce viral proteins. Now, very important to understand here that the process of synthesis of viral messenger RNA is not that simple. Now, the RNA-dependent RNA polymerase cannot directly synthesize this viral messenger RNA. Now, for the synthesis of viral messenger RNA, this RNA-dependent RNA polymerase requires 5' cap, and 5' cap is present on the human or on the host messenger RNA. So, very important to understand here that the enzyme endonuclease of RNA-dependent RNA polymerase cuts the 5' cap of the host messenger RNA, and on this 5' cap of the host viral messenger RNA is synthesized by this RNA-dependent RNA polymerase. So, this is how, by the use of the enzyme endonuclease, this RNA-dependent RNA polymerase synthesizes the viral messenger RNA, which further translates to produce the viral proteins. Now, replicated viral RNA and these viral proteins are utilized to produce influenza virus progenies. Now, these influenza virus progenies, they fuse with the host cell membrane to come out of the host cell by the process of exocytosis. But during the process, their heme agglutinin protein remain stuck with the host sialic acid residues, which prevent exocytosis, which prevent the release of viral progenies. So, at this point, the protein neuraminidase cuts the connection between viral progenies heme agglutinin and host sialic acid residues. So, this releases the viral progenies from the host cell, and thus the virus spreads the infection. Now, first category of anti-influenza virus drugs inhibit M2 proton ion channels. So, inhibition of these proton ion channels prevent acidification of the viral core structure, and thus they block viral uncoating, and therefore the viral ribonucleoprotein is not released in the host cell cytoplasm. So, this prevents influenza virus replication. Then second category is of viral RNA polymerase endonuclease inhibitors. Now, these drugs inhibit the enzyme endonuclease. So, now 5' cap is not removed from the host or from the human messenger RNA, and without 5' cap, RNA-dependent RNA polymerase cannot synthesize viral messenger RNA. So, this prevents synthesis of viral messenger RNA. Further, it prevents synthesis of viral proteins, and further it prevents the multiplication of virus. Now, third category of drugs are neuraminidase inhibitors. Now, these drugs prevent the enzyme neuraminidase to cut the connections between viral progenies and the host sialic acid residues. So now viral progenies are not released from the host cell, and thus the spread of viral infection stops. So this is the mechanism by which these drugs, they produce anti-influenza virus effect in the host. Now let's discuss pharmacology of each class of these drugs. Now first category of drugs are M2 proton ion channel blockers. The prototype drug is amantadine. Another drug is the rimantadine. Now rimantadine is a methyl derivative of amantadine. Rimantadine is more potent, longer acting and better tolerated than amantadine. Now both these drugs are administered orally. Now, as already discussed, these drugs are M2 proton ion channel blockers and they prevent uncoating of influenza A virus. So, this inhibits replication or we can say this inhibits multiplication of influenza A virus. Then indications. These drugs are indicated in the prophylaxis and treatment of influenza A virus. Now, but here it's very important to understand that all current strains of influenza A virus are resistant to these drugs, and hence treatment with amantadine and rimantadine is not recommended. Now here it's important to know that amantadine is also used in the treatment of Parkinsonism. Then adverse effects. These drugs can produce gastrointestinal adverse effects like nausea and anorexia. Then amantadine can produce neurological adverse effects like insomnia, dizziness, nightmares, lack of mental concentration, and it can also produce ankle edema. So this is the pharmacology of M2 proton ion channel blockers. Now, the second category of drugs are the neuraminidase inhibitors. The prototype drug is the oseltamivir. Another similar drug is the zanamivir. Now, oseltamivir is given orally as well as parenterally, while zanamivir is given by inhalation as a powder. Now, oseltamivir is a neuraminidase inhibitor. Now, it is a sialic acid analog. That means its structure is similar to sialic acid residues which are found on the surface of the host cell. Now, it is a prodrug. Its active form is oseltamivir carboxylate that inhibits the influenza virus neuraminidase enzyme. Now, as we know, this enzyme is essential and it cuts the linkages between sialic acid residues on the host cell and heme agglutinin protein on the viral progenies. So, inhibition of this enzyme prevents the release of progenies from infected host cell. So, this stops further infection with the influenza virus. Now, oral bioavailability of oseltamivir is around 80%. Its half-life is 6 to 10 hours and it is excreted by the kidneys. Now, oseltamivir is indicated for the prophylaxis and treatment of influenza A, swine flu, bird flu, influenza B. Now, very important, if oseltamivir is started at the onset of symptom, then it is the most effective drug that reduces severity, duration and complication of the flu. Now, adverse effects that can be produced by oseltamivir are abdominal pain, nausea, diarrhea, headache, weakness, cough and insomnia. So, this is the pharmacology of neuraminidase inhibitors. Now, another category of drugs are the viral RNA polymerase endonuclease inhibitors. The drugs are baloxavir and favipiravir. These are administered orally. Now, as discussed, these drugs, they block the endonuclease enzyme of viral RNA polymerase. So, endonuclease cannot remove 5' cap from the host messenger RNA, and in the absence of 5' cap, viral RNA polymerase cannot synthesize viral messenger RNA. So, this prevents the synthesis of viral messenger RNA. There is no synthesis of viral proteins. So, this inhibits the process of viral multiplication. Now, indications. These drugs are indicated in the treatment of influenza A and influenza B. Now, these drugs, they reduce the duration of symptoms if taken within 48 hours of symptom onset. Then adverse effects, these drugs can cause nausea, diarrhea, pulmonary bronchitis and headache. So, this is a pharmacology of viral RNA polymerase endonuclease inhibitors. Now, let's study few multiple choice questions on anti-influenza virus drugs. Now, the first multiple choice question. Following statement is true regarding amantadine. Let's see what are the four different statements. First, it is used in the prophylaxis and treatment of influenza A and influenza B. Now we know amantadine is used only in the prophylaxis and treatment of influenza A. It is not used in the treatment of influenza B. So this statement is not correct. Then amantadine acts by inhibiting release of virions from the target cell. So what is the mechanism of action of amantadine? Amantadine blocks the M2 proton ion channels and that prevents uncoating of the virus. So this statement is also not correct. Amantadine produces its anti-influenza action by preventing the uncoating of the virus. Then amantadine is used in Parkinsonism. This we have studied that amantadine is also used in the treatment of Parkinsonism. Then its usual mode of administration is parenteral. No, amantadine is given orally. So the correct statement with regards to amantadine is the C. It is used in the Parkinsonism. Then next question, drug of choice for bird flu is, here we have four different options. First option is the oseltamivir, then ribavirin, then entecavir, then acyclovir. Now oseltamivir is used for the treatment of bird flu, this we know. Then ribavirin, it is used for the treatment of hepatitis. Then entecavir, this is also used for the treatment of hepatitis. It is not used for the treatment of flu. Then acyclovir, it is an anti-herpes virus drug. So the correct answer is the oseltamivir. Oseltamivir is used in the treatment of influenza. It is also used in the treatment of bird flu. Then the third multiple choice question, antiviral drug given by inhalational route for bird flu is. So here we should know the route of administration of these drugs and their indication. So amantadine is given orally and it is used for the treatment of influenza A only. Then zenamivir is used for the bird flu and it is also given by the inhalational route. So this can be the correct answer. Then the third option is rimantadine. Rimantadine is also given orally and used in influenza A. Then oseltamivir. Oseltamivir is used in the treatment of bird flu, but it is given orally and parenterally. So the correct answer is zenamivir. So zenamivir is a drug that is given by the inhalation route for the treatment of bird flu. Then the next question is drug inhibiting uncoating of viral RNA. Now here we should know the mechanism of different antiviral drugs. So the first drug is the vidarabine. Vidarabine interferes with the synthesis of viral DNA, not the viral RNA. Then rimantadine. Yes, rimantadine is a M2 proton ion channel blocker and it prevents the uncoating of influenza virus. It prevents the uncoating of viral RNA. Then acyclovir. Acyclovir is a anti-herpes virus drug that competitively inhibits the viral DNA polymerase. Then diadenosine, it is an anti-HIV and it is a nucleoside reverse transcriptase inhibitors. So the correct option is the rimantadine. So rimantadine is a drug that inhibits uncoating in the viral RNA. It inhibits uncoating in the influenza virus. So these are the few multiple choice questions which are based on anti-influenza virus drugs. So this is all about the pharmacology of anti-influenza virus drugs. Please note, information provided in this video is only for your academic purpose. If you require to treat influenza, or if you want to use any of these drugs, please consult your physician. If you find the video useful, kindly like, subscribe and share this video. Thanks for watching this video.